If a school system attempts to keep children from full-time in-person school, I will hold up every bill with two amendments, one to defund them and another to allow parents the choice of where the money goes for their child's education. Do I sound fed up to you? That's because I am. I'm not a career politician. I practiced medicine for 33 years. I graduated from Duke Medical School. I've worked in emergency rooms. I've studied immunology and virology. And I ultimately chose to become an eye surgeon. I've been telling everyone for a year now that Dr. Fauci and other public health bureaucrats were not following the science, and I've been proven right time and time again.
Dr. Bailey, I agree with you that misinformation is leading to vaccine hesitancy, and I think probably the largest area of misinformation is actually coming from the government regarding natural immunity. There's actually dozens and dozens of peer-reviewed articles on natural immunity. The natural immunity is robust. A study from Washington University School of Medicine just recently says mild infection with SARS-CoV-2 induces a robust antigen-specific long-lived humoral immune memory in humans. Cleveland Clinic study, 50,000 employees, showed that those who had had the disease previously had the same, if not better, immunity than those who'd been vaccinated. If we deny this and we say, stick your head in the sand, everybody be vaccinated, don't worry your pretty little head about whether you've had it or not, we don't do any testing, we have lots of ways of testing for immunity, guess what? The people are going to have hesitancy because they think you're not telling them the truth, which is true. That isn't the truth. We do know that you get robust immunity from this. We also know that even taking conservative estimates from the CDC, that about 100 million people have had this. How do we know that? 34 million people have tested positive, but even the most conservative antibody surveys show that at least 2 people for every 1 that got it also had it. That's 100 million people. And so if we discount that, we say, oh, we're never getting to herd immunity. You have all these articles saying, we'll never make it, we'll never make it. We don't have enough people vaccinated, but then we say, oh, we got to go harder. Now we're going to go for the 10-year-old, then the 5-year-old, then we're going to go for the 2-year-old, then we're going to say, oh, you can't leave the hospital until you're vaccinated. People are going to be hesitant because they don't believe you. And they don't believe that the risk of the disease in children anywhere equates to adults. Over 65, it's at least 1,000 times more dangerous. The death rate under 25, about 1 in a million. If you combine natural immunity with vaccine immunity, Dr. McCary of Johns Hopkins estimates that 80 to 85% of adults have immunity and that we have reached herd immunity. Yet the government insists on discounting or really not counting at all the millions of individuals who have acquired natural immunity. This scientific error causes the government to believe that we haven't gotten there, that we have to go harder and harder and harder. There are reports of myocarditis. It isn't decided yet. We're in the means of talking about this, and if we just say blithely, go take your vaccine, don't think about this, that's not good medicine. We should think about it. I don't know what the risk is. It may turn out that it's 1 in 10 million. And then by all means, I'd say go. If you're over 65, I say without question, the vaccine is way safer than the disease. But I can't say that with surety for a 10-year-old. I really can't say that. I also can't say that we haven't reached herd immunity and that we're pushing so hard on the kids that we might do damage to children with this. It's an unknown question. The science is not completely done on children. They're discussing it this week. How frequent is myocarditis? We don't know that. If it's 1 in 100,000, and the chance of myocarditis in the normal population is 1 in a million, I would probably say you ought to think twice about it. But another way to do it is we could test the children. We could test the adults. If they have antibodies, let them make a choice. Let them make an intelligent choice. Some people will still choose to be vaccinated. But we are so adamant, get the vaccine, don't think about it, that leads to hesitancy because people don't think we're following the science or that people who give that advice are following the science. So my question is, shouldn't previous infection be considered in the effort to push vaccination on our children?
Yes, I think previous infection should be considered. I also think that we need to understand that a previous infection is not as robust in protecting against new variants as the vaccine.
We actually don't know that. We actually don't know that. All of the testing on natural immunity and vaccinated has shown that we have great immunity, both with the vaccine and with natural immunity. The Delta variant that everybody's talking about, the vaccine is very good for it. So you see hysteria on TV. We're still driving this debate about the hysteria of the Delta variant. If you get vaccinated, there's a 96% chance you won't be hospitalized. The numbers are very similar for natural immunity too. This what if has been played, but it's just not true, and we're scaring people needlessly. We should study it honestly in a rational fashion and give people advice, but we shouldn't be pushing people, don't think about it, just take a vaccine. Dr. Bailey, failure to acknowledge natural immunity has led to the policy of indiscriminate vaccination. So when we do this, we divert the vaccine from those who truly need it. In India, getting to herd immunity may take a couple of years. 6,000 people were dying a day recently. And they're taking the advice of the government experts in our country that they should vaccinate everybody indiscriminately. In doing so, tens of thousands, if not millions of Indians will die, because you're going to have millions of people who have already had it. If you could get the vaccine to those who need it more, you will save lives. It's the same way with diverting it to those over 65. In my community, in this country, we're giving it to young, healthy 28-year-old volunteer firemen. You know, that makes no sense at all. So do you think in countries like India, we should take into account whether you've had it to try to make the vaccine go farther so we could save lives?
I can't comment on vaccine administration strategies in other countries. I do know that we need to be a good part of the global community and provide as many vaccines as we are able to make after we've taken care of our own population, which we have plenty of vaccine for.
Well, first of all, Senator Paul, I want to thank you for the email newsletter that I get. It really helps me understand the current issues and understand what your position is and the work that you're doing on our behalf. I am a 72-year-old retired teacher, and I'm truthfully dismayed by many changes that have taken place in our nation in the past months. But the thing that I'm most concerned about for the sake of my children and my grandchildren is the integrity of our elections going forward. I wonder if we'll ever again have confidence that our elections are conducted in a fair and honest way, especially as I read about the contents of the H.R. 1 bill. And I'd like to know what your plans are to help us Kentuckians have confidence in our elections in the future.
Well, that's a good question. And, you know, a free country requires people to be confident that they're allowed to vote, that nobody's turned away, that if you're eligible, you're allowed to vote, and that your vote will be counted. And counted only once, by the way. But the thing is that in the last election, we did something extraordinary that we've never, ever done before. Traditionally, people vote in person. 95% of people would show up in person. When you show up in person, it's easy to verify who you are. So imagine it's this way. You show up at your precinct, and there are 2,000 people that are registered to vote. There's a book. Your name is there, and you've seen how it works. There's a Republican and a Democrat sitting at the table. They ask you for your ID, you show it to them, you sign next to your name. It's almost impossible to vote twice, you know? It's almost impossible to impersonate someone because you show your driver's license. It works. Through the mail, if you let people collect mail, so let's say you say a left-wing or a right-wing group can go to your house and bring an application and then go to your house and bring a ballot, and then they collect them from you and they show up at the mailbox, if they show up at the ballot place at the election and they have 1 million ballots and they turn them in, it's pretty hard to know, are those 1 million valid ballots? It's hard to verify signatures. I've seen statistics saying 13 to 15% of signatures just can't be verified. It's just too hard. We aren't experts. Most of us can look and kind of think it's the same signature, but it takes experts, and not many people are expert enough to actually tell it. Now, some people have said what we ought to do is really try to get most people to vote in person. I agree with that. And if you're going to vote by absentee, maybe you should have to have an excuse. You can't come, you're ill, or you're infirm. And maybe you should still have to show a picture or write down a number from your driver's license to put in, so it's not just your signature, there's some kind of identification. I think that's a good idea. I've testified before the Kentucky legislature. I testified before the Kentucky House and the Kentucky Senate on an election integrity reform bill. Elections have always historically been at the state level. The Constitution says the time, place, and manner of the elections is to be determined by the states. We've never had federal elections. even when you run for Senate or for president, it's a statewide election for federal office. If we allow it to become federalized, there's a great danger that it will become more politicized. Nancy Pelosi, a partisan, a very frank partisan, has introduced H.R. 1. It's an election bill, but it says elections won't be conducted by the states anymore. They'll be conducted by Congress. They'll all be mail-in votes. Everybody will be eligible. You don't have to register. And I think it'll be something that would lead to a great deal of less confidence. It'll lead to a great deal of potential fraud if we do it that way. So I'm going to do everything I can to stop it. In the meantime, I have been talking to people throughout the country at the state legislative level, not just Kentucky, people in Georgia. I've spoken to the governor of Georgia. I've spoken to legislators in Arizona and in Texas. And everywhere I go and every chance I get, Ohio as well, Iowa, trying to get people to do state legislative election reform, election integrity reform. So we do need to do a better job because people need to be comfortable on both sides. I don't care if you're a Republican or a Democrat. Everybody needs to be comfortable that your vote counts and that you're not being turned away. But the easiest way to do that is with in-person voting, and we should go back to where primarily people show up in person so we can make sure that the elections do have integrity.